Hey everyone, I'm so glad that you're back with us. And I'm really excited about this interview today. I have Dr. J on with us today, and I've had just an amazing opportunity to get to know Dr. J a little bit and even work with him. He has a clinic in England and in other places too. I'll let him tell you a bit about himself. But I've been so fascinated and interested in, of course, like cutting edge science and what alternative methods are out there that are available to people to help with their wellness and their health. And so, Dr. J, I'm going to let you introduce yourself, and maybe then we'll jump into some questions and answers.
Hi, everyone. My name is Dr. Jayanth Peddi, but you can call me Dr. J in short version. I am a medical doctor and I am a GP based in Leeds in UK, family medicine doctor basically, but I have been in the field, in this field, integrative medicine for the last 8 to 10 years. This journey began with my own health issues where suddenly went down in 2014 and I was looking for help, and I went into a few traditional Indian methods which kind of helped, but not really. Then I was trying to find out what's the root cause, and that was the time when functional medicine was just literally coming up in Europe, UK, and the rest of the world. I think it was there a bit before in USA, but it was called as clinical environmental medicine in Europe, or ecological medicine, where we look at our relationship, our body with the environment and the causes of environmental factors which can affect us. So you can also call, there are multiple names for it. You can call it as functional medicine, which originated from USA, the term. You can call it as ecological medicine, which kind of came from Germany. Germany is the leader for this. It's been there for decades and decades. And it's now called as many places as integrated medicine because we use so many different methods. It's never ever one method to make the patient better. And I have a clinic based in Leeds, United Kingdom, which is a couple of hours away from London, not too far. And I have a small clinic in Hyderabad in India, but we are trying to expand into a bigger clinic because of the need of the population at the moment. As you already know, over the last 3, 4 years, we have an explosion of cancer, autoimmunity, autism, especially in the last decade, and everybody is sick. I've just been recently to a health optimization summit in London just around 4 weeks ago, and virtually everybody I met there, everyone was sick. I mean, it
Wow.
doesn't
And
have
these
to
are
be.
practitioners. These are the
Yeah,
practitioners.
people
Wow.
are not always practitioners. Some of them are more, what can I say? They are biohackers. Some of them are just come as lay people with their own health issues and their family health issues. But you can do so much for everyone in this field. The whole world is yours. If you open your mind and think about, think outside the box, rather than just trying to do the symptom control, you can do a lot, even yourself without anyone's help as well.
I love that you say that. I was introduced to the world of, living in the States, functional medicine and integrative medicine. And it was probably about 20 years ago. I was myself diagnosed with a severe, pretty significant health condition that I managed to reverse. And so what I love about what you're saying is I'm such a fan of thinking outside the box and getting, if the model we're using isn't working, let's change the model. And so I'm really excited to talk to you today because our listeners are caring for people that are living with dementia. Most of our listeners are family members. We also have several medical practitioners that listen to this podcast as well. So whether they're professional caregivers or doctors or nurses or neurologists, we all are impacted by the stress of being a carer, whether that's professional or for our families. And one of the things I'm excited to talk to you about today, and I know, oh my gosh, I'm gonna have to bite my tongue because I know there's so many things that I'm gonna have so many questions, and I'm sure that we'll have you back to do some deep dives in different areas. For instance, I'm really curious about the new kind of cutting edge science and outside the box thinking on treating dementia, of course. But today I want to focus on caregiver stress. And again, whether it's professionals that are burned out, working in a high stress field with high expectations, where their heart is wanting to connect with their patients, but the time and the, red tape isn't allowing them to do that. Or it's someone that doesn't have the luxury of taking time out to listen to their body and take care of themselves. People are just struggling. And so I guess my first question for you is, what if you could walk us down the path of what happens, like what are the most common physiological impacts that you see for people that are living with high stress?
One thing before I even start about stress, I need to mention is your brain is your biggest frequency generator. Okay. So if you know about frequency healing or how, frequencies can actually help you, your brain's frequencies can make you or break you. Okay.
Wow.
So I specifically have seen patients with high stress going into a lot of health issues, all because of the stress. We can detox them like there's no tomorrow, do FRSs, environmental FRSs, which is generally found most in European countries, and now it's available in UK as well, maybe soon with us. But you can detox yourself 100 times. You can have all the infusions, but if you don't control your stress, nothing's really going to help you much. Yes, you will get a bit better, bits and bats, but it's not really going to help you much. People have to manage stress, including myself. I was, you can always call me part type A personality. I have to do it, maybe not too much, but, partly, I would say. And one of the best ways, to control stress is meditation. Doesn't cost you a penny. Okay. You can do it yourself. You can take guided medication from other people, or you can pay someone to help you. And there's so many free places. People are more than happy to guide you to do it without any additional cost. So stress can really affect a lot of it can actually cause a lot of physiological, emotional changes. If you look at what we do is integrative medicine. And in that, I mean, I actually have trained, let me put it this way, I've trained with multiple practitioners. I have quite a few mentors, and including Dr. Klinghart, who many people know about, and his pyramid system. And even in the Indian traditional system, if you see, the physical toxins are just in the base level. The emotional toxins or the emotional, which parts which affect you are slightly higher. And the highest always is always your brain, and how you can control the stress, and the meditation which comes, and how you relate yourself to the higher entity. You can believe in God, you don't have to believe in God, but everybody assumes that there is a higher entity, and your relationship with the higher entity, and that's how you deal with the stress, in addition to the meditation, or you can call it that as a meditation, your relationship. Okay. If you don't really look after yourself, especially with the stress part, your physical toxins start expressing themselves. Okay. You can have all the toxins in the world. You see some people, 95-year-old, having 5 pints of beer in the pub virtually every day, drinking like a fish, working in the mines, and he's fit as a fiddle. You just can't complain anything. He's for his age, he's absolutely fine. He eats junk, has fish and chips, fried foods. Doesn't mean I want you to have that. But
Right. But we hear those stories, right?
yes,
My grandma drank whiskey and smoked cigarettes, and she lived for 102.
yeah, and yes, the genetics play a bit in there, but it's not just the genetics; it's the mind-body relation. Yeah, that's what it plays. They don't take much of a stress. They like Okay, I don't have £1 million, but I do have money. I can spend £5 a day. That's enough for me. I have my money to spend on the weekend on the pub or the race course. I'm enjoying myself. That's what counts, okay? Because that's what I want to say. Your physical toxins can be removed, or you can have plenty. And if you don't control your emotional toxins or the stress, they can manifest down the line. It's a downward causation. Okay. So they can manifest quite a lot immediately. And you can see many cancer patients nowadays, you ask them, more than 70% will remember one episode of a family stress or a personal stress which triggered, and within a few months, they were diagnosed with cancer.
Wow.
More than 70% people. This has been done. And somebody has actually done an interview with a lot of, I can't remember the name out of my head, but this has been, the research has been done, and more than 70%. And the rest of the 30%, they may not have had stress, or they may not have even remembered that this was stressful. Because sometimes you don't always remember a stressful incident because you're always in high stress. For example, my job is a high stressful job, and maybe yours is also a very high stressful job. So you might think that it is normal for you. Yeah.
And I think with caregivers, that's what happens is it creeps in so slowly. You know, your loved one starts to have, you don't even realize their symptoms for
Yeah.
often many years, and until you look back and you've adjusted, you've tweaked, you've taken on more, you've started to worry. It just creeps in until you're crashing and burning, until your body is, literally screaming at you. And yeah.
Yeah, with caregivers, again, with especially dementia caregivers, they have seen their loved ones, how they were before, and how they're slowly deteriorating. They, even after a few months or maybe years, depending upon how they're deteriorating, they don't even remember your name, who you have been looking after for, years and years. And that really affects you. Okay.
Yeah,
Um,
absolutely.
and this is, as you said, Laura, it's a slow creeping problem. You can do a lot with dementia. I mean, we may help you, we may not be able to help you, but at the end of the day, it's not something which is, I would say, as a incurable disease or anything like that. Yes, you can put it into remission. We don't cure anything, but you can definitely put dementia into remission. There have been a lot of clinicians who had a lot more experience than me, who have done even people with dementia for 5 years, 7 years, and after 1, 2 years of treatments, they
Wow.
remember virtually everything.
Yeah, that's incredible. And Dr. J, like I said, I really want to have you back and focus on that. I know our audience is like, wait, what? We've been fed, at least in the US, and I'm sure worldwide, the message that there's no cure. There's no cure. And that how many people, do we meet with that go to a neurologist, finally get a diagnosis? They know something's wrong and something's off. They get a diagnosis. Many people share a sense of relief knowing, okay, there's something I can point at now because, there's something going on. But then they leave the office. The neurologist says, here's your diagnosis. Come back in, a year or 6 months. And
Yeah.
they're given nothing. People are literally floundering, dealing with the emotional stress, the psychological stress, the physical stress. And so just hearing you, a physician, and I've talked to many physicians. I just want our listeners to know that this is not, we're hearing this more and more, that there are things that can be done. And I'll just throw this one more little caveat out and we'll pivot here. But the other thing that people are experiencing is a tremendous amount of fear, uh, that their family member, that it's inherited. So that because my parent has dementia, now I am at high risk of getting it. And people don't want to look at it. They don't want to think about it because they don't feel empowered to feel like they're able to do anything about it.
I have to say something about it.
Yeah.
99.99% of any conditions we humans suffer are not genetic. They are not hereditary. I have to say it's 99.9. There's always kind of 0.01% or something like that, where it is, hereditary at a certain age you start experiencing. But even those, you can actually modify or at least prolong the way, even the genetic diseases. Okay, I'm talking about even because the genetics affect the mitochondria, and there are newer ways how you can actually modify the mitochondrial health actually. But rest of the 99.99%, you don't really have to worry about. Yes, there's always somebody, everybody has heard nowadays with the ApoE gene main causing the Alzheimer's and the dementia issues. And look, at the end of the day, I do some panels for genetics, but it doesn't make a huge difference because yes, when certain SNPs are there, single, and nucleotide malformations, you want to call it as different ways. But if you have any of those, yes, you're prone for having a bit of dementia issues down the line, but doesn't mean it's the end of the world. There's a lot of people. If you see, for example, I'll just give you one example. It's not related with dementia. Lots of people have back pain. Lots of people. You do an MRI for 10 people with back pain. Okay. 9 of them don't find any changes in the MRI of your spine. Even if you do an upright MRI, because now most people, they lie down in an MRI machine and you don't find it. It's not the right way of doing it because the pressure happens when you're standing up. So you really, ideally, if you can afford to do a upright MRI, it's a bit better rather than lying down. But coming back to the other stuff, so if you do an MRI of 100 people who don't have any back pain, and you will find lots of people with disc issues, disc protrusions, disc even compressing the nerves, but they have no issues. And it's vice versa. Okay, so you have to understand that just because you have the gene issues doesn't mean you are going to get it. Yes, if you want to do the test, that's fine. And if you want to do some modifications with your health, go on a bit of a keto diet or modified low carbohydrate diet, because in the long term, sometimes people always struggle with the keto diet. Yes, you can always modify it with the specific carbohydrate diet. There's so many different types of diet we have to adjust according to what your need is exactly. And if you modify those things, you don't really have to worry about saying that, oh, just because my mom is unwell with dementia, I am going to get it. Because remember, again, my first words were your brain is your biggest frequency generator. If you think something is going to always happen, the whole world will come together and make sure it's going to happen.
Yes.
You put
Yes.
yourself in a
Powerful.
yes, the power of universe is more than what you can control. If you think, even if you're in a bad situation, if you think, oh, it's okay, it will pass by, it will definitely pass by. Everybody goes through stress. Everybody has stress. As long as you're living, you have stress. It doesn't matter whether it's a human or a dog or
Yeah.
everybody has some stress. Okay. So you don't really worry about that you're going to get dementia just because your mom has it. Yes. If you have, I don't have any, this is not anything, I don't have anything against Americans. When I would use the word SAD diet, sad, I mean,
Yes.
and
We know that term, don't worry. Yes.
So if you're having your fried stuff and your burgers and all the junk food and the colas and sleeping at 2 in the morning and waking up late, it's not the ideal way. There is a way to sleep. If you if you have done a bit of traditional Chinese medicine, every meridian has a time and that has a resting time as well. So the ideal way to sleep is around 9 by 8:39. But yes, even if you push it up to 10, and remember, your brain only detoxes at night.
Okay, that's
They won't
important.
detox in the day. And your brain, actual brain, doesn't have veins inside it. Yes, you have the big veins, but there's no small veins going inside it. The way your brain detoxes is it shrinks to 60% of its size and it eliminates all the toxins out, and that passes through the G lymphatic system, which we only know surprisingly over the last couple of decades. We don't even know about the G lymphatic system before that.
Wow.
And that passes on to the veins, and that comes out. Yes, many people have issues with the outgoing veins, with chronic infections, narrowing of the veins. Maybe that's for a different time, we can discuss later on. So you can do a lot more about it. Just sleeping on time, eating healthily, exercising,
Mhm.
and a bit of meditation, that can control a lot of your stress. A good sleep. I probably was a bad sleeper, as in the past I used to sleep at 11, 12, and we used to wake up at 8. But my health was amazing at the time. But you're forgetting I was 35 at the time. 30, 35. I'm 45 now. So it looks all more than a decade, but this, with aging process, you have to look more after yourself. And none of the stuff I've told you doesn't cost a penny.
Yeah,
Everything
that's
costs.
true. Yeah, and we've talked about brain and mindset. We've talked about sleep. We've
Yes,
talked about diet and paying attention to the natural rhythms of our natural cycles.
the cycle. And when it comes to natural rhythm, I have to say something though here. Yes, many people like to use the Aura Ring or the sleep trackers. I personally am not very happy with using these electronic stuff on your body, because they can cause what we call as interference fields. Not many parts of the world know about interference fields. Interference fields are basically fields which can cause disturbance in your body energy passages, which are your acupuncture meridians, your cell communications, everything. Not many people know about this. This is, especially in the Western world, no, unless you have some exposure to the German speaking part of the world, or a bit of Latin and the Spanish speaking part of the world, they know a bit about interference fields, but many people don't know. Yes, you want to track your sleep, put it on once a week or once in a fortnight, check how you sleep. Apple Watch, maybe once in a while, but not as a regular basis. You have to keep an, because they itself can interfere with your sleep though. Because people put an Apple Watch on your wrist. You have 6 meridians passing here, not one or two. 6 meridians, 3 on this side, 3 on this side. And and those are very important meridians. The electronics can interfere with the meridians, the energy passing.
But not only, I'm going to make a little joke, but I know I wear this hair tie on my. When I saw you, you gave me a hard time about that. You're like, take that off. But what I hear you saying now is it's not just the pressure, but it's the electronic impulses that are
impulses which are coming. Yes, it can be good and bad. We use a laser watch through your radial and ulnar veins and arteries to stimulate, but that's a different thing. We use it at a short term. That's totally different kind of stuff. Okay, but the minute you put continuous electronic impulses in that area, it's not really
going to
recommended.
change the electrical flow of the body. Yeah.
And every time we do a special technique called as autonomic response testing, a kind of variation of kinesiology, we see virtually everyone who wears these electronic stuff interferes with their health issues. It always interferes.
This is a whole new day and age, right? Where we're having to pay attention to things like that. Yeah.
Exactly. So coming back to the stress side of stuff, and also the dementia carers, do not worry that you are going to get it who you're looking after, whether it's your family or friends, or whether you're just a caregiver, paid caregiver. Just don't think that just because someone has it, you're going to get it. You look after yourself, keep yourself the healthy with exercise, meditation, diet, rest of the simple stuff yourself. Yes, we can do a lot more interventions than the basic stuff. If push comes to shove, we can do a lot more stuff, but it's not the end of the world. That's what I want to say.
Yeah. Thank you so much. You're bringing up a couple of things that I think are so important, and I just want to highlight it again. But I know that I've worked with functional medicine doctors professionally as well. There was a short time where they would refer patients to me that were stuck, if you will. They tried all the interventions, they did all of the procedures, and the person wasn't moving forward. And these were doctors like yourself that really fully understood the psychological impact of how a person was thinking or making sense of their world, of their condition. And so at the time I was practicing, I would use models like hypnotherapy, and we would just dive a little deeper into those quote blocks, the psychological blocks of healing and getting better. And it was incredible to me. So everything you're saying really resonates. The power of our mind, the power of how we think about what is happening to us, what might happen to us, and recognizing that we have more power than we realize. We truly are the creators of our own experience.
Yeah.
And so when we talk to caregivers, who are often in a position of feeling helpless to the external situation happening, they're watching their partner disappear before their eyes. They're grieving, and they feel so helpless to change or do anything. The one thing that can happen is changing the way you think about what's happening. And that, I know that concept can sometimes be difficult for people that are wanting to just fix it and not wanting to, live the experience that they're living. But I guess I'm just validating what you're saying in the sense of whether the studies are coming out so significantly right now on research around people with a variety of different chronic health conditions or situations that they can't control in their life. And when they change, they tune into the frequency of the brain and the heart, and they change that, whether it's the actual energy and frequency, or it's changing the thought about what's happening to them. It's almost doing the same thing. When you change your thoughts, the emotions and the chemicals in your body change. And so
Exactly.
I'm just glad this is powerful stuff that you're talking about. And so I just appreciate.
It's exactly true. Sometimes, when you change your thoughts, just changing the thoughts, your body detoxes immediately. There is a way where we do, as I mentioned, what we do, the autonomic response testing, we do an emotional version of it where we talk about what emotions you're actually holding to, or if you're holding to anyone else's emotions. And the minute you actually release those thoughts and emotions which have been affecting you, a physical detox occurs, an emotional detox occurs. And there is a slightly different way we approach it as well. Especially, people nowadays know a lot more about vagal nerve stimulation. People start using these multiple devices like Get Sensate or Pulsato, and there's a few of the German devices with the ear stimulation, which stimulate the vagal nerve. As you know, with stress, what happens? It causes flight and fright response, which is a sympathetic response. You do need it. Without it, you can't survive. If you in olden times, if you have a lion or a bear attacking you, without the sympathetic nervous system, you have to run. You're not gonna sit there. So you really
Gotta think about it.
you don't want to be like a calm, meditating person just because the lion is trying to fight. So you do want a balance of these systems. But nowadays, with our life, with the chronic stress, your sympathetic system is really up rather than your parasympathetic system. They should balance each other. Sometimes, yes, you need to be the sympathetic, should be higher side, sympathetic. Sometimes it should be the parasympathetic, especially during the sleeping and the calming time. But you need to have a balance, and you need to know how to do it. The measures which I've told you, from meditation to diet to everything, actually can help you with these stuff. And there's probably one of the best things I use to put them in balance immediately is neural therapy. Yeah. With the neural therapy, it's a very special German technique where we use tiny amounts of local anesthetic, procaine, and some nutrients and some saline, and inject in certain areas depending upon the history to release the fascia. Because how does your body work with the nervous system? Your brain has a thought, it can be passed. For example, you want to move your arm, and your brain thinks about moving the arm. The signal goes from the brain to the nervous system, all the way to the peripheral nerves. You move your arm, and you get the signals to your muscles. It works vice versa as well. Okay. So if you give a signal to your fascia as well, it tells all the way to the nerves, to the spinal cord, and onto your brain as well. So if something is wrong in one organ of your system, for example, if your liver has a bit of fatty liver, or a sludge, or it can express in fascia in different areas. So if you release the fascia in that area, it tells the body, oh, don't worry too much about this. And then it actually sends a regulatory signal to the spinal cord, then to the liver, and the liver starts detoxing, and the patient starts making sure that the parasympathetic system is working better, calmer, and you see some immediate results.
I love that you're talking about this. And I just want to make sure our listeners are tracking you. So I'm just going to recap what I hear you saying is that the vagal nerve, which controls the parasympathetic and sympathetic responses in the body, right? And so the sympathetic state, a high sympathetic state is that survival fight flight mode, and the parasympathetic is the rest and digest and repair mode. And like you're saying, we need both to be operating efficiently. One is not better than the other. But what happens in high stress states, such as being a caregiver, is you're always in a high sympathetic state. And so I'm curious if you can share what happens to your body when you're in a high sympathetic state all the time. And then the second piece that I heard you say is that you were describing this treatment called neurotherapy that helps communicate with the body to reset to a balanced state. Is that right?
Exactly. So coming to your first question, if you're constant mode of sympathetic, over activity, you are in a constant stress. You start having, as you said, it's a flight and a fright mode. What happens when you're in a flight and a fright mode? Your muscles start contracting, your organs start overworking, and everything is overworking. So there's no rest. And then there's a limit to what it can do. And to balance it, you have high cortisol levels. Your adrenals are overworking. And initially, they will try to calm it down. But after a little while, your adrenals stop producing cortisol, which is quite important. It is important. There should be a balance, okay? And what do you end up with? Adrenal fatigue. What happens? Fibromyalgia, and myalgic encephalitis, ME, different words you want to say, aches and pains, tiredness, because of the constant stress mode. And that's only the physical aspect. Emotionally, you get anger issues, you get low mood, depression, anxiety, all this, the constant state of stress. And coming to the second question, when you asked about what does neurotherapy do, because your parasympathetic system, one of the main stuff is your vagal nerve, okay? And it has afferent, efferent nerves. You don't really have to do anything with the vagus directly. Just injecting certain areas of your body where you have the afferent nerves for the vagal nerve, or where the fascia is extremely tight, you release it, and the signals go to your vagal nerve, and it tells the rest of the organs and the brain to calm down. And this happens immediately. And when you do that calming down, people get very emotional. They can get even tearful. They can get, total calm. It can happen whichever way. So as a practitioner, we are prepared for whichever way the patient goes in. But it's one amazing tool I have learned over the last couple of years, where a very high stressful individual with an extreme fibromyalgia or ME or any other symptoms, you can put them into a nice parasympathetic override. It is not a cure, remember, because you still have to control, it can be a little long, but the more you do once in 2 weeks, after that, maybe once in a month, or then you don't really need much often. And if you do the rest of the measures, then you don't really need to do, like, you eat healthily, then you detox yourself, saunas, all this stuff. So there's less stress on the body, less stress on the organs, less stress on the sympathetic system, and there's not much need for the parasympathetic to really control the sympathetic side of stuff. Yes,
Okay.
it has been an amazing tool in my arsenal to help.
Yeah, which is amazing. Can you speak to, I'm curious, just for our listeners, I want them to walk away with some practical things that they can do, which you've really touched on, the meditation, the diet, the sleep, uh, changing your mindset. Are there any other tools out there that you're excited about or that you want to highlight? And then again, I'm curious if you were to give just and this might be unfair of me to ask this, but if you can kind of throw out a scattering of different tools or ideas, and I'm thinking of things like maybe, like for instance, I know that when people live in a high stress state, they're burning through magnesium, or, so are there little things that they can think about including into their daily life or their diet or their supplements or their protocols that might help?
Yes. First, as I've said in the past, the first thing when you're in a high stressful state or a high stressful job or a carer job, you have to look after. You need some time for yourself. Have a fixed time every day. Don't let yourself override with whoever you're caring continuously and your job. And you need to have a fixed time. You want to do, let's say, for example, an half an hour of breath work with meditation, compulsory every day. Keep that time for yourself, and half an hour of personal time to spend with your family. And also, TV helps you, radio helps you, going for a walk helps you. Whatever you enjoy the most. If running keeps your thoughts calmer, go for that. If you feel like, you know, for example, I get angry. All I do is go and do a 200-pound bench press. Put all my anger on the bench, or sit with my dog and talk to him.
Whatever. I have a client. I was just
Whatever tickles your pickle.
Yeah, I was just talking to this client about art for her.
Yes.
She can get out her paints and she's just in another world. And yeah, so just
That is one side.
whatever works for you.
Yes, and that's one side. That's the easiest part of what I have suggested. Coming to the secondary part, because of your stressful job, you are burning through nutrients as if you have an open pit fire. So you really have to take a lot more nutrients, lot more minerals, vitamins. I wouldn't want you to overdose on anything. Just, you do have to understand the recommended daily elements. Don't even go anywhere near that. I would need another 10 hours to talk with you. The RDAs, the RDAs are pitiful. Okay, that's all I can definitely say. Okay, you will get more information online about the actual need. For example, magnesium. Somebody says, oh, all you need is around 10, 20 milligrams of magnesium. You must be kidding me. Everybody is magnesium deficient. I am magnesium. Everybody is literally, and there's no way of measuring it. Unfortunately, there is a tiny way where they look at inside the cell, red cell magnesium, but realistically speaking, it's not really. Unless you have some renal failure or some extreme cardiac issues, there are certain things which you have to worry about. Always speak to your clinician when you take higher doses of certain stuff like magnesium. Other than those, most people, you have no issues. If you have slightly more excess of magnesium, you'll excrete it, okay? Either through poop, it can cause a bit of diarrhea if you take too much of magnesium oxide. You'll probably curse me for that. But if you take the right type of magnesium, there's so many different types. Taurate, which helps you with sleep and brain activity, glycinate, which helps you with a lot of stuff, including muscle relaxation, oxide for your gut. So there's so many different types of magnesium. This is only one mineral I'm talking about. There's so many other minerals. And remember, your soil nowadays with intensive farming doesn't have any minerals, virtually negligible amount of minerals.
I'm glad that you're bringing that up, because I think people think, oh, I'm eating healthy. I'm eating lots of vegetables, but and it's such a good point. We're not getting the same minerals.
You are getting a decent amount of vitamins, because most of them plants manage to still synthesize, and the sun can give them some, and then you can synthesize some. But as long as you have some healthy bacteria, many can be synthesized inside your gut. The clause is healthy bacteria, which need healthy food, which we're not really eating, to be fair. Okay, but the minerals are, everybody is mineral deficient, quite a few. The tests are hopeless. Unfortunately, the tests are not really useful at all, especially for mineral deficiencies. Yes, they are. If you're really scarce, they will show up, they will show up on there. But you also have to remember, there are some people who take too much and they have selenium toxicity, hair fall, and everything. So don't overdo it, but slightly more than your recommended daily elements in the long term will definitely help you. So because you're burning through them all the time with your poor diets, chronic stress, I would definitely advise you to supplement with especially minerals, a good multivitamins over 2, 3 days a week. I mean, most people always forget here and there, but there are certain things you have to take, like vitamin D. It's technically not a vitamin. It's one of the best vitamins, if you want to call it as. It's actually a hormone vitamin. Okay, so you really want to be the doses what normally clinicians recommend is very pitiful. When I started 20 years ago, people were saying 100 units. You must be kidding me. I mean, people who have chronic stress, they burn through vitamin D like there's tomorrow. Like your body needs it, your gut needs it, everything, as long as you're sticking to a minimum dosage of 3 to 5,000 units, even up to 10,000, you wouldn't even need any kind of testing at all. I would do it once after a couple of months to see if your levels are going up, because sometimes people take even 10, 15,000 units because of the poor gut microbiome and poor absorption. It never goes up, or because they're burning through. So they might have to increase quite a bit, or they might have to take an injectable version of D3 to load them up. And then, your clinician might advise you how to dose it properly afterwards. A standard between 3 to 5,000, no need for testing. Even up to 10,000, no need for testing. Take every day. Vitamin D works in synergy with vitamin K2, and you need the B vitamins as cofactors, and magnesium. So these are the 4 things everybody should be taking, especially people who in high stressful jobs or dementia carers. You have to be on these. And you take these within a month, see the difference in yourself. These 4 things and some a good multi-mineral, preferably a liquid version. Okay, there are lots of ones in the market nowadays with the lower doses, but a good absorbing power, where they have come from. I don't want to be endorsing any specific brand. They have come from, the volcanic rocks, but you have to be very careful with where they come from, because along with the normal minerals, unless they test, you can also have heavy metals. So you really want to be careful where you get the minerals from, especially if you're sourcing it with the humic and the fulvic acids, which itself help you to detox as well as, energize you. So it's not, in the world we live in is not an easy place to live in, especially healthy.
We're constantly hit with a barrage of
Yeah. The
environmental toxins and
air we breathe, 20 years ago, when I first moved to England 25 years ago, approximately, the water was so good, the taste was so good, the tap water was good. Now, even a government done survey says more than 70-80% of the water is polluted with long-term pollutants like PFAS, plasticizers. So you want to be very careful what you drink. It doesn't matter where you're from. People use, and remember, just because I advised, don't drink from the taps, don't start drinking bottled water. That has its own problems with plasticizers and plastic, microplastics. Okay. So you want to be very, very careful, what you drink, probably preferably reverse osmosis water. Yes, you lose some minerals, but this is why I'm suggesting take some additional minerals every day and a good multivitamin, because you're going to be burning through the vitamins and minerals, all these cofactors, because of your chronic stress.
yeah. And one of the things that I think about is overwhelm. When people are already at their limit, and then they're trying to figure out a protocol or help their loved one. They're just trying to survive. They're just exhausted and doing everyday life plus caring for someone else. And so I'm always very aware of, I know, and I feel that you're doing this too, Dr. J. I feel like you know so much, and it's like, how do you condense this down to really manageable, easy steps for people to do? And I feel like in our conversation today, you've done a fantastic job of just kind of educating about, and I know we've only touched on just a little bit, but I just want to recap a little bit that if somebody, just so that people aren't feeling overwhelmed with all the things that they could be doing or should be doing, is if they just simply pay attention to their brain, pay attention to the thoughts that they're having, and just the act of knowing that their thoughts are impacting their physiology and their life. Just knowing that is all you need to know. And then paying attention to your diet and your sleep. And we talked about, you educated us really well about the vagal nerve and neurotherapy, and then bringing it back to some just simple practical things nutritionally. And you named 4. I'm just going to recap them: vitamin D, K2, the B complexes, and magnesium in a multi-mineral liquid. You said pay attention to the water. I mean, sometimes it's just pick one thing. One little thing can make such a huge difference and help you feel empowered as well.
Well, what I would say is start slowly. If you think like, oh, tomorrow I'm going to do everything what we have talked about, you will be overwhelmed.
Yeah.
Start with having a good night's sleep. Okay, that's the first thing. And then start with 5-minute meditation and 5-minute breath work. Then increase the time. Then always, just go to your favorite brand or ask locally what's available, which is a good brand for all these multivitamins or multi-mineral complex, magnesium. I mean, I'm assuming you have a lot of listeners in USA, and there are some really good companies there. I'm not going to endorse some things, but there are some companies where you can buy bulk pure supplements without any additives in there. Pure magnesium, pure other stuff, pure. There's no absolute additives in there. And you can make your own supplements with that. Just put it in water. Instead of buying the capsule of magnesium, you can just measure with a $15 measuring device 1 gram of magnesium. You can put it in a glass of water and start drinking. You can put a few grams of MSM or other stuff. I mean, I can talk about so many other things, but you don't really need to take everything in one go. And we are humans. Yes, just you can miss a day or 2. And I actually advise people to take a 1 or 2 day break every week from all these supplements. And then when you use it for a couple of months or 3 months, take a month's break. Okay. There's no harm except for vitamin D. And even vitamin D, if you want to take a break for a month or a few weeks, there is no hard and fast rules, because not everybody, because if you want to do blood tests, I assume you pay through the nose in USA. It's quite expensive. I think nowadays you do have some labs where you can do reasonably priced, as long as you don't go through the insurance. If you pay yourself,
You pay correct. Yeah.
yes, have baseline one, and then do once a year just to see where you're standing, just to look after your long-term health. So the easiest ones, start with the most easiest ones, the cheapest ones without costing anything: the meditation, breath work, nice sleeping, eating healthily. Yes, unfortunately, eating healthily is expensive organic.
It's hard to eat. You think it should be so simple, but people have to work hard to find healthy food.
Yes. And no offense again, I do have to tell you, but when you have organic, sometimes the labeled, especially USDA organic, the standards are not the best when you compare to the European standards of organic levels. It's been diluted over the last decade, especially. But sometimes you have farmers near where you live, and they don't put any additives or any chemicals. They don't have the labeling of USDA organic. But if you know them, you probably get a better quality from them than a label, and it's going to be probably a lot cheaper. And if you have a nice small patch, grow yourself. All you need is, but some people say, a simple 1/4 of an acre, you can sustain a family of 4 for a whole year if you know how to do proper gardening.
Wow, that's incredible.
I'm not good at.
Yeah. But that's incredible. You realize that. Yeah.
Start simple, take simple measures over a good few weeks. Go with the flow, and you can get one at a time and then start doing stuff. That's my suggestion. And if you have health problems, definitely seek help from a clinician who has some experience. And this is I didn't touch about this. The clinicians, many of the functional medicine clinicians, when they get stuck, the commonest reason why we get stuck, even I was in the last couple of years, when I enlighten myself, is the emotional issues, because emotional issues manifest physically, and you need to start releasing the emotional toxins. Then you get better. That's the time you start seeing some amazing changes in your physical health. Subconsciously, you store a lot of emotional toxins. You don't realize it, but you store a lot of stuff. You have to work through those emotional toxins, releasing the bad emotional energy in the part of the world where it doesn't affect anyone, those kind of stuff. talk to a clinician who is a bit more experienced. Sometimes it doesn't always have to be a medical doctor. There are some other natural, especially in USA, you have some really good naturopathic doctors who have done some amazing work in this kind of field. Not just the emotional work, even the toxin removal kind of stuff. We had learned so much from them, to be fair.
Nice. Nice. Well, can you tell us if somebody wants to learn more about you or your work, what is the best way to reach out to you or find more?
There's two ways. One, I have a wellness center where you come and choose. I can't give you any advice in there. You can just come and say, I have plenty of devices where we use a lot of other adjunctive therapy, like huge red light and infrared bed, which we use from from photobiomodulation for neurological diseases to cancer, where we use what we call as photodynamic therapy. It's a nice bed where people can lie down, experience how their energy level changes, the physical energy. And if your cells communicate with photons, biophotons they called us, not just neurotransmitters. Except in the Western speaking part of the world, everywhere they know that biophotons are quite important. They can even use ChatGPT to learn that.
It's common except in the Western world.
Yes, exactly. And that's one way. So we have lots of devices from red light therapy, infrared therapy, not a simple panel. We have a huge bed. And we have intravenous blood irradiation where we use different lights from red, violet, blue, ultraviolet, infrared, green, and yellow. So your cells have different cells in your body have different demands. Their cells are chromophores, so they absorb certain light frequencies and they distribute the rest of the lights. So, for example, your red cells, they love red and infrared, and they take their biophoton energy from them. We use them in so many conditions. Even without seeing a clinician, when you can commit yourself for 10, 15 sessions continuously, as at least 2, 3 a week, you see some amazing changes. As in, it can help in chronic Lyme, it can help in dementia, it can help in so many things. And then we have an amazing device called as photon wave. All you need to do, it's totally non-invasive. You just look at the light, and there is a specific pathway not many people know. There is a nerve pathway from your retina to the back of your brain where it tells your brain and the rest of your body what to do. It can detox you. It can put your emotional stress to go away. It can cause changes in your skin. It can do inversion of toxins and cause removal of toxins. So these are outside the box. You can just say, look, I want this program for this. And you can actually have PEMFs in the wellness clinic, which is pulsed electromagnetic frequencies. So they change how your cell voltage is. They can increase it, modify it. They can help you open the channels, remove the toxins. They can do lots of stuff. If you put even in Google or ChatGPT or anywhere what PEMF is, we have a low strength one, we have a high strength one. And in addition to that, the photon wave, red light, infrared wave for the intravenous blood irradiation, the red light and infrared therapy, the PEMF therapy. I even forget what I do sometimes. These are the wellness side of stuff. We do intravenous detoxes, the Myers cocktails with vitamins, nutrients, curcumin, all the stuff, rest of the stuff. We can do that. That's the wellness clinic I have. That's not much contact with the clinician. Whatever you prefer, you decide to choose. And one of the best therapies I forgot to mention, I don't know how I forgot, is ozone therapies. We do lots of different types of ozone, from rectal ozone to joint injections to, one of the special procedure is a major autohemotherapy, where we take some blood out, mix it, and give the blood back to you, which causes a lot of changes because when the ozone gets mixed with your blood, it actually there are lots of interleukins and cytokines. The ones which modify your rest of your body are produced. Okay. The immunomodulating ones, not the bad ones, the good ones in a simple layman's language. So they can help you. And we also do a procedure called as EGO. Very few people in the whole world do it. There's only, I think, 3 or 4 in the whole of UK. I'm the only doctor who does it. It's called as extracorporeal blood ozonation and oxygenation. And what we do is we take blood out through a nice juicy vein from your arm from one side. It goes into a filter, and the ozone mixes with the blood in the filter. The filtrate can come out at the same time, and the filtered blood goes back into your other arm or leg, wherever you have a nice vein. And this actually helps in a lot of conditions, from, if you do a research, from chronic Lyme to people with dementia, because you need to look at the cellular mechanism. It actually helps in oxygenation of the cells. It also helps in oxidation of the bacteria, the viruses. With people with chronic fatigue always have high viral load, most of the people, not everyone. So it helps in those people as well. But if you need to commit between 5 to 6 sessions, and if you can combine them with the intravenous blood irradiation, you get some amazing results. We use even ozone for ear insufflation, rectal, vaginal, if you have so many chronic vaginal problems. And if you want to desensitize yourself, people with nowadays, everybody has leaky gut. Okay, lots of people have leaky gut. Okay, so you can desensitize by taking a bit of tiny ml of 5 or 3 ml of blood, mix with ozone, and then give it into your buttocks so that your cells don't react suddenly with all the stuff what you're getting through the leaky gut. So there's different ways of using ozone. Sometimes in the past abroad, my colleagues have used intraperitoneal into your gut for tumors, ozone therapy. The whole world is yours, all I can say. That's the wellness.
Yeah. The menu knows options.
The
You were
wellness
talking-
clinic is called as Serenity Health Wellness. It's based in Leeds. We are actually in the process of having the website changed, and the new clinic called as Ozone and Light Sanctuary is just
Oh.
very different, which will be coming up soon. And I do have a medical clinic. It's a CQC registered clinic. We have to have regulatory authority on us when we do any of this stuff. So we do a lot of evidence-based medicine and the clinic. Not technically inside the box, but there's a lot of evidence even outside the box as well. So we treat, as long as it's not anything surgical, we can help you. If it's not anything totally genetic, I mean, you can always have a 15-minute consultation, which doesn't cost a penny. It's free. If you need it in half an hour, it doesn't matter. We don't look after time as such. So you can always seek our help. And it's called as Lifecare Functional and Integrative Clinic. And that's based in Leeds as well. And that's a medical clinic, integrative medical clinic. We look at anything from autoimmune issues to dementia, neurological, to cancer patients.
Are you able to see? We have so many listeners from all over the world, and are you able to meet virtually with people and consult virtually? Are you like?
We do virtual consultations. Originally, I would like to see you. I mean, it depends upon what we're trying to treat. If somebody comes to me, in a late stage, something like cancer, or if somebody comes to me in severe dementia, then it's better if I see you physically once, then we do some intravenous treatments. But if somebody is in early stages or anything like autoimmunity, in those things, or even quite a few of neurological conditions like MS or anything, we can manage remotely by supplements, nutrients, herbs. There's so many things we can do. We do a lot of therapies, from herbs to supplements or orthomolecular medicines, IV therapy. We do a special one called as microimmunotherapy, where we use your own body's communicating signals like interleukins and cytokines and nucleotides at a very low dosage of 10 to the power of -9, and you see some amazing results with that. Even I was surprised. There are some remedies in there where somebody is suffering, for example, mitochondrial issues with the chronic fatigue, and there's a therapy called as MIREG, and within 2 months of it, people see some amazing changes. Yeah, and somebody suffering from, especially there's a one called as MISI, and that helps in inflammatory bowel disease with people with like Crohn's or ulcerative colitis. Just 4 weeks of treatment. One of my colleagues' son had this issue. He's tried a lot of detox measures, IVs, everything. We were able to control it, but not, more than 50%. 1 month of treatment, we had some amazing changes.
Incredible.
And as you probably heard, we do neural therapy as well. which is one hell of an. But for that you have to be here.
Yes,
It's
yes.
really a
Yeah.
physical one, and you shouldn't be scared of needles.
I'll share to the audience. I've experienced a couple of neurotherapy sessions, and yeah, it's so helpful to hear you talk about it because it's the experience that you have when you receive it. You physically feel the reset happening. Like it's pretty incredible work.
Nothing goes as fast as neurotherapy.
Yeah,
You
it's
see some
instant. Yeah.
amazing changes in a second. In a few seconds, you see some. But you have to be prepared for emotional changes, physical changes, and we do everything from pain management, as in we're not a pain clinic, but just releasing the fascia, a few joint injections can help you quite a stuff. We don't do any spinal injections. I have to tell you that that is a specialized stuff where you have to go to a pain clinic, or it has to be done under CM guidance, CT guidance. We don't do that interventional stuff. We hopefully plan to integrate maybe in the next 1 year an environmental apheresis where we can take out all the toxins from your blood, which is very, not many people have it. There's a few centers in Europe which do it at the moment. I don't think anybody does it in USA. They are planning to do it in USA, but I do not know your regulations. But I think it's pretty flexible in USA. So I know a couple of clinicians last year when they came to Germany for a bit of training in this. They said they were going to buy them and use them in USA, but I do not know of anyone at the moment who does it there. But it's one hell of an arsenal as well. So, and we do a bit of emotional work as well, releasing the emotional toxins through autonomic response testing. And one of the main things I do in the clinic, every patient, generally, we, instead of blindly putting you on, 50, 100 different supplements, sometimes you feel like you're eating supplements, not food.
Yes, the handfuls of supplements.
So we do a special way to find out which are what we needed through a bit of kinesiology, but we support it. It is medical legal. Autonomic response testing is medical legally recognized in the German speaking part of the world, may not be in the Western speaking or the English speaking part of the world, but we support it through special tests. So instead of asking patients to spend $20,000 on vaguely 100 different tests,
Yeah.
use the test carefully and support our findings, what we get through ART, and then put you on the right kind of nutrients, supplements, all the stuff. And we do a lot of other stuff, from a bit of hyperthermia to increase your core body temperature. Some people with autoimmunity, they can help. Some people with cancer, they need that. We are in the process of acquiring something for local hyperthermia, which may take a little while
Wow.
to get those. And sometimes I actually forget what I do. It depends upon what you actually
Oh, that's yes, yeah. But you know what? I love that you shared all this because it's just giving people I think for me anyway, it gives me hope that there is a whole world of, like I said, new cutting edge science and research and possibilities. I especially appreciate talking to you, Dr. J, because you have such a knowledge worldwide of all the latest and newest stuff, the treatments that are coming out and research that's been done. And I think that people, we only know what we know and we don't know where to look. And so it's really nice to tap into a source that is pretty expansive and knowledgeable. So,
Yep, and not many people, again, we want to help everyone get through their health problems. Especially in the last 3, 4 years, there's been an explosion of neurological conditions. I mean, one of my mentors, Dr. Klinghardt, he used to tell me I used to see one ALS, which is a version of motor neuron disease, amyotrophic lateral sclerosis, one every month or something like that, once in a few months, few years ago. Now they're seeing one a week, one case a week, and that's in his clinic. And
ALS. Wow. Wow.
if there's an exposed cancer, every family 20 years ago, most people never heard of cancer. Maybe one remote family member or somebody, oh, this person in the village had it. Now, one or two family members. And now they're saying, these cancer research charities are saying, they're having, oh, we're going to think it's 1 in 2 people are going to have in the next 5 years. And they're going to say in a few years, everybody's going to have it. So these are
Wow.
simple measures what you can do.
Dementia. I mean, dementia is just skyrocketing, and it's yeah. Oh wow, wow, wow.
And when it comes to dementia, again, in the whole world, there's some new amazing treatments with peptides. I don't know whether you heard of it. We do peptide treatments. It's amazing what you can do with certain peptides. Yes, we also do, I forgot to say, we do sono and photodynamic therapy. Just give me 1 second. I'll just switch on the battery.
Yeah, sure, no problem.
With that. So we do a sono and photodynamic therapy for certainly for certain cancers, depending on what we do. And uh, there are certain things which can help you with fecal transplants. We work with another clinic where they do fecal transplants. I don't do it myself, but we work with other people who do that. And again, with bioidentical hormones, these are you reach some amazing immediate changes within a month or 2 weeks. Two to 3 weeks, or sometimes even a couple of months. If you optimize your hormones, even people think, including myself, before I got trained in bioidentical hormones, I was thinking, oh, it's only for menopausal.
Menopausal women, yes, our menopausal.
No, it's not just for menopausal women.
Wow.
With autoimmune issues, people with neurological conditions, especially certain neurological conditions, even with traumatic brain injury. Okay, many people with dementia, with neurological conditions, in the past had some traumatic brain injury, TBI. And there's a very special panel, a 28 blood panel looking at neuroendocrine hormones. And if you optimize that, some people have some amazing changes in their dementia. And those are very fast, without doing any IVs or other bit of detox, but not a huge amount. Just by optimizing the neuroendocrine hormones, you get some amazing changes. And you have some pretty good clinicians in USA who have done this panel, and they have been doing this probably more experience than me in this part. And you get some amazing results with it. So whatever at the end of the day, what I want to say is you look after if you're a dementia care, or if you're in a high stressful job, you are going to have those, we call it as transference, all the stress what they are experiencing, you're going to experience. And also you have to do your job. So you need to really look after yourself. Simple stuff, start with simple thing, then supplementation, a bit of detoxing, saunas, emotional detox, talking to someone. You have a dog, the dog might hate you, but talk to the dog.
Well, your dog loves you unconditionally.
Yeah, but you tell all the time your problems to him or her, he's like, oh, okay.
Enough already.
You want to be, yeah. So there's so many things you can do. Just have some time for yourself every day, a protected time. Like, for example, in UK and Europe, you have protected learning time when you're in a training job, especially you're a medic. So like that, you have your protected 1 hour, 2 hours a day, in addition to your sleep time. You fix it. Whatever happens, doesn't matter. Get someone to look after your loved ones for that 1-2 hours. You have your time. This is extremely important for your own health. This is what I definitely have to tell and emphasize on more and more.
Yeah. Thank you so much. Thank you. And I just want to just honor the work that you are doing, again, around the world. You talk about the transference and the people that you're impacting and the hope that you're giving. And I just want to thank you for that work, Dr. J.
Oh, definitely. And it was, honestly, it was a pleasure meeting you, through Roy. And I'm glad I have helped you a bit. And I'm glad that you tried out the neural therapy sessions.
Yes, me too.
Yes.
All right. Well, thank you so much.
Yeah.